So everybody has 20 minutes, basically, yeah?
No, the first one is slightly longer, and then Prof. Mattis is a slightly longer slot.
Okay, cool.
And then Ben and I just have 10 minutes each.
Thank you. Okay, we haven't had any new people join in the last 2 minutes, so I think let's get started, and as more people join, that's also fine. Welcome everyone. This is the last session in our series on collecting social data under COVID. It's been a really, really excellent series so far, and we've had some fantastic presentations. So thank you for all of you who've presented and all of you who've been participating in all of them or some of them, or even if you're here for the first time. We're very glad to have you. I think one of the great things about this series has been that it's really about sharing practical experiences amongst practitioners. So less about the the findings where we often sort of present the methods as if they were either self-evident or easy, but it's actually about the difficulty and the challenges and sometimes the trade-offs and the kind of, just the sort of professional difficulties of doing the methods correctly. And that's, we've had to do a lot of adaptation under COVID, but it's, I think, also just generally a conversation that we need to have more of. So we're looking forward to continuing the relationships that we've built through these conversations. Today's session is focusing on large surveys, and particularly ones that are going back into field on a face-to-face basis, either ones that were in field in the last several months or ones that are getting back into it now. And so with that, looking forward to starting off with our colleagues from Genesis Analytics. Let me hand over to Aisha and Tamika.
Thanks, Tara. And I'd just like to say thank you for having us today. We're excited to share our research with you. Can I just check whether you'd like us to present, or will you be sharing the presentation that we shared earlier?
Better to share from your side since you'll be controlling the slides, yeah.
Just 1 second.
Tamika just tested it earlier and it was fine. There we go. Okay, great. Wonderful. There we are.
Computer seems to be freezing for some reason.
Aisha, I can share it as well if you'd like.
Yeah, I don't know why.
Well, from Tamika's side just now. All right.
Just let me know when you'd like me to change slides.
That looks perfect.
Sure. Thanks, Tamika, and sorry about that, everyone. Okay, so Tamika and I will tag team through this presentation, and what we'll be telling you about today is a large survey, as Tara said, that we've been doing on conducting client exit interviews for the Women's Integrated Sexual Health Program in the time of COVID, and just reflecting on some of the lessons that we've learned. So the way we've structured this presentation is just to give you some context, some background to the project, go a little bit into the aims and give you an overview of the methods, and then spend more of our time going through how this impacted field work, what did we do to mitigate the challenges, and then just spend a few minutes reflecting on the lessons learned and how we plan for field work going forward. So, Tamika, you can go to the next slide. Yeah, okay, so the WISH program is DFID's flagship family planning program, and it's there to scale up its support to integrated sexual and reproductive health and rights services in about 26 countries in Africa and Asia by 2021. So additionally, so in essence, they're aiming to reach 4.1 million additional family planning users by 2021. And they're essentially 4 cross-cutting outputs of the entire WISH program. So one is individual choice. So they're looking to strengthen individual knowledge, choice, and building this community support for sexual and reproductive health and rights to drive national ownership, so sustainability of programs in countries, to improve access to services and expand choice, and to increase women's choice and access to services through building evidence-based innovations and best practices. Tamika, you can go to the next slide. So the way the WISH program is essentially run is it's driven by what they call 2 lots. So lots 1 is run by Mary Stopes International, or MSI, and they have a range of partners, and they primarily focus in providing services in most of the West African countries. And then there's lot 2, which is led by IPPF, which is the International Planned Parenthood Federation. And it's also referred to as the Wish to Action team, who generally support in East and Southern Africa. But IPPF is a sub on lot 1, and MSI is a sub on lot 2. So there is cross countries that overlap between the 2 lots and who they are responsible for. Okay, next slide. So essentially what happens is under the WISH program, IPPF, so IPPF was the consortium that contracted us to do the work, and they deliver services through their member associations in each country. So the member associations are independent, locally funded organizations within the country, and they provide family planning services under the WISH program, and that generally happens through 3 different channels. So one through a static facility-based channel. They also provide services through mobile outreach, and that is in harder to reach communities, and then also through community-based distribution model, which is largely through community health workers who provide family planning counseling or a range of family planning services as well. So IPPF then contracted us to do client exit interviews across 17 countries in which them and their partner, the International Rescue Committee, provide services. So there were 6 lot 1 countries. So that was more of your West African countries, and then 11 lot 2 countries. And then we partnered with Kantar to undertake these client exit interviews. So what the aim of the CIs is largely to determine whether the program is actually reaching their most underserved population and to track their progress. But if we split out the aims more specifically, it's 1, to understand who their family planning client population are. So in terms of age, demographics, disability, so who's accessing the services, to monitor progress towards programmatic targets, and then to determine performance against key programmatic indicators, as this is a payment by results contract, and then to provide and inform strategies in order to adapt their program and understand the lessons learned. Okay, so this was a cross-sectional survey of sampled family planning clients across the WISH supported SDPs. So as a first point of call, we received ethics approval in all countries prior to starting the survey. And then the people that were included in our survey was every person who received a family planning service on the day. And depending on the country, it was either with clients that were 15 and older where it was allowed, or 18 where it was not allowed, and we received full consent. So this was generally written consent in except in Pakistan, where we had to get verbal consent instead. Okay, so we had started these client exit interviews in about, well, the project kicked off in about May 2019, but then fieldwork happened towards the end of the year, beginning of this year, and we had still had 5 of our 17 countries to complete when COVID-19 emerged. So those countries were Malawi, Mauritania, Mozambique, Sudan, and Uganda. And there were several challenges. And we sort of lumped them into themes with sampling and data collection, training, and more logistical and project management issues. So we'll just go through all of them, and then we will speak to how we addressed each of these issues. So the first thing that related to sampling and data collection was that we saw that there were a reduction in the number of people that were accessing family planning services across the channels, but mainly within the static STPs. So that's made it harder to achieve our sample size and so we had to spend a lot more time at each STP. We also found that there were lower participation rates because naturally people were afraid of getting COVID-19 and were opting not to participate in the study. They were also, due to lockdown restrictions in some of the countries, we couldn't always access the service delivery points. So for example, in Uganda, there was lots of restriction in towards accessing the border districts for a long period of time. And so we couldn't access certain SDPs. Mobile outreach activities also were suspended in certain areas and in certain countries. So we couldn't go there. And because of the lockdown restrictions, there were limited movement of community health workers. And so we often had difficulty getting the sample that we need there for a certain period of time. And then because COVID emerged, there were certain protocols that needed to be placed. And so we did have to, in all the countries where fieldwork still had to happen, we had to provide additional training on COVID-19. That really involved understanding what the COVID-19 situation was in each of the countries. It was a protocol on how to safely conduct these interviews with countries in terms of also making them feel safe and to take in the proper precautions in terms of what was required. And also to put in certain methods in place for enumerators to report if they had any symptoms themselves and to come up with a strategy to sub out those. And then there were certain project management and logistic challenges. Naturally, because of COVID-19, our timelines for data collection needed to be extended. And also, as I mentioned, it was difficult accessing certain service delivery points. And this was either because the area was inaccessible completely, or sometimes because of transport costs. So most public transport were only operating in the main routes, and so we needed to find alternative modes of transportation towards rural areas. So that was our major challenges in a nutshell. I'm going to hand it over to Tamika, who's going to talk you through how we addressed each of these challenges.
Thanks so much, Aisha. So in terms of how we addressed each of these challenges, we've looked at the same sort of categories, and I'll just touch on them briefly. So under sampling and data collection, there was a reduction in the number of family planning clients accessing services. So we designed our sampling plan with a sampling interval, and this was to ensure that interviews were spread throughout the day, specifically in high volume health facilities, where there was a risk that all interviews could be collected in the morning or in the afternoon or at a certain time of day, and thereby bias the results. So we needed to have a sampling interval, which means that you need to have accurate client flow information. But because of COVID, we were not able to get this accurate client flow information. And what we needed to do is equip the field workers with the tools that they needed to actually calculate the sampling interval when they arrived at the health facility. And what we asked them to do was to go to the health facility, speak to the facility manager, and then using a quick tool that we'd given them, calculate what their sampling interval needed to be. And this ensured that actual numbers were taken into account. in addition, lower participation rates due to fear of COVID-19. So Aisha's already touched on this, but we had an additional training session for COVID-19. And this training session really equipped enumerators with the information they needed to conduct the interview safely, but also to communicate that to the interviewee, which really helped us boost our participation rates once we applied that. Some STPs were inaccessible due to lockdown. As Aisha mentioned, mobile outreach activities were suspended, and there was a limited movement of CHWs providing services through the CBD channel. And this meant that we really had to work very closely with the team on the ground, as well as the member associations who were implementing the CEIs in the different countries. And they were often plugged into what was happening on the ground and what the changes were in health facilities and which health facilities we could access, and what the different COVID regulations were in different countries. So we often used WhatsApp as a primary mode of communication, which we found was very successful after COVID-19 hit, just to keep a closer eye on, or just to have a ear to the ground in terms of what was actually happening. So that was quite successful. And then there were a number of fieldwork challenges. We weren't able to solve all of them, but in terms of training, additional COVID-19 training was required. So in order to do this, was both because we had to do refresher trainings and because we needed to equip enumerators with the skills that they needed to execute the CEI safely. So we used a phased training approach, so multiple small trainings in different locations, and we made sure that PPE were always used. And then we also ran through different scenarios to understand the pros and cons of doing training virtually or in person, and applying the strategies depending on the situation. So in some cases, we did some virtual training. In other cases, we relied on in-person training. And then in terms of project management and logistics, we didn't do this time round, but we think that it's really important to include a timeline contingency plan from the onset, and just a general risk mitigation strategy. And this is essentially very important for this framework because it is a payments by results framework. So yeah, that's what we had to do. But what we also did is we reviewed the incomplete data sets and shared the important findings, which allowed some decisions to be made with regards to payment by results, but not necessarily the final versions of that. I think I've missed something, but I can't find it right now. But it's just that we also developed very flexible sampling plans. So for example, in Uganda, our sampling plan is obviously key to the success of the CEIs. And what we found in Uganda was that because of the COVID-19 restrictions, we could only access the inner district STPs and not the border district STPs. And of course, this biased our samples significantly because your border district STPs are sharing a border with neighboring countries, and then obviously have different profiles based on that, especially with regards to poverty or demographics, which are some of the indicators that we were looking at. Poverty was a payments by results indicator specifically, so it was very important for our sampling plan to be correct. But because of the other additional thing, which was the timeline pressure, we needed to report on this quite soon after we'd started fieldwork. So what we needed to do was develop a phased sampling strategy. So to first go to all STPs where we knew we could visit within the inner district STPs, and then have two separate sampling plans for the border district STPs. One which looked at accessing the border district STPs and what we would do if we could access them. And then another which, in the event that we were not able to access the border district STPs by a specific date, which we decided as the cutoff date, we'd then have to go back to another set of inner district STPs, which were close to the border in terms of geographic location. So yeah, that's what we had to do in Uganda with regards to having a flexible sampling strategy. So just to reflect on what COVID-19 has taught us about data collection going forward, is that you always need to have a risk mitigation strategy when conducting fieldwork. And some of the key steps to put in place are to first identify key steps that ensure the success of your project, identify threats to those key steps, and then prioritize those threats and develop a plan for each of those threats in terms of how you'll manage it, and clearly document that plan so that when unexpected events do occur, you do have a plan in place. And this plan could look at timeline contingency, budget contingency, understanding the pros and cons of different scenarios, and so on. So with that in mind, it's also good to establish your plan based on core principles, which allow flexibility, because although you may have a plan in place, it's not necessarily always as easy to stick to it when the real thing does happen. Then the second thing that we learned is that the self-screening tools that have been developed under COVID are very useful, and it's good to always do sort of self-screening of enumerators to monitor their medical status, which ensures the safety of other enumerators and field workers, as well as the safety of all other participants who you will be interviewing or collecting data on. So we found that that was very important given COVID and other emerging infections which could occur. And then the third thing is that sampling plans are very important and can change by quite a bit. So it's good to think through how to make it as flexible as possible while maintaining its scientific rigor. So these are the three things that we learned from COVID-19 that were most important and that we will be applying to all fieldwork projects going forward. So that's everything from my side. And thank you again for letting us present to you. And I'm looking forward to learning about other projects that have had similar challenges and how they were overcome. Thanks so much.
Thank you very much. We've had some questions in the chat. You actually kept to time very, very nicely. Thank you very much. What I'm thinking is, so what we usually do is go through all the speakers and then do all the questions at the end. Solly and Neil, are you ready now? Should we start going ahead with you, or should we just do a couple of questions first?
I'm ready.
You're ready. Okay, let's stick to then keeping the questions for the end, if that's okay with everyone. All right. Solly, please. Oh, yeah, Julia?
Sorry, Solly, would you like me to share the slides for you, or do you have them your side?
Let me try and share it, and you can confirm if you can still see.
Yes, that looks great.
Okay.
All right. Yeah, if you could, yes, perfect. All right, thanks very much.
Okay, morning, colleagues. I was supposed to do this presentation with my colleague, Neil. Unfortunately, we just informed now because I'm in the office that actually we need to leave the office because we have a positive case that was reported. So he has to go and attend to that particular emergency case. That's unfortunate, but yes, this is our new normal, and I think we just have to adapt it to this new normal. So I'm just going to take you through, I think our first presentation that we did almost a month ago, we explained some of the product that we are producing and some of our plans in terms of the program for 2020 under the COVID-19 pandemic. So today I'm just going to present what is some of the things that we have done and what are some of the plans for 2021. In terms of the 2020 program, for us, the data collection was suspended around the 20th of March. Then our labor force surveys, which is our quarterly labor force survey, it was conducted using the KT, and I think colleagues have seen the results that were published, I think last month. That results that are coming from the survey that we conducted using the KT method. With regard to the other product that we are also conducting, which is your general household survey, your domestic surveys, and also the governance and public safety justice survey, the collection also resumed the 1st of September. We are using also KT. The results for these three surveys will come out early next year. However, we are not sure about the future. And I think that's the reason why we're having these sessions, so that we can share our experiences. So I think from our side, as I started saying, we're trying to come up with ways in which we can improve our data collection, and also the issue of trying also to maintain or following the health protocols when we are conducting our surveys. So I will also go into details in terms of what are some of the ideas that we are thinking, or some of the plans that we're thinking that we're going to implement in the next year, which is 2021. But at the same time, we also need to talk about the quality and also try to maintain the issue of continuing with our normal operating model, which is a face-to-face, but at the same time, managing the quality of data. And also at the same time, also not exposing our survey officers into to the COVID-19. So I think from our side, the previous speaker already mentioned these issues, the issues around the sampling, the issues around how do you now reduce your content in terms of the questionnaire, the analysis part, and how do you also continue in terms of the quality to ensure that you still have the reliable estimates that are coming from the survey itself. So what we have done is that we tried to sort of come up with steps that we're going to take to mediate the impact of the COVID-19. So we have categorized it in short, medium, and long term. And I will also touch a bit on census, because also census is also going to be affected by the COVID-19. So the short term, which is this program for 2020, the organization decided that all our surveys will be conducted using the KT method. So in terms of the medium and the long term, we have established a committee which looks into the mixed mode approach, especially for our program for 2021 and beyond, to say how do you now have a sort of a hybrid data collection model, but at the same time also ensuring that you don't lose all the quality dimensions that we have identified across our statistical value chain. In terms of the census, they are also trying to test all these other data collection methodology, your KT, your Kawi. They've already done some tests, and there's a pilot that is planned for February, where they will also try to test this KT Kawi methodology for census. Just to maybe give insight in terms of the short-term issues that we've just picked up for the 2020 program. Obviously, the issue of our sample is not accurate, because we are sampling. Our business model is that we do face-to-face, and we visit our respondent at their respective dwelling units. So we didn't have a list of telephone numbers where one can actually draw up a sample, a representative sample, and obviously we will have an issue in terms of the lower response rate, because of the way we are doing our sampling. It's based on the dwelling unit. The data collection, like I said, it's a face-to-face, and we know that some of the data collection model, like your KT and Kawi, they have a lower response rate in general. We have to reduce our data collection instrument. Because of it happens right in the middle of our program, we didn't have sufficient time to go through the test and also to make sure that all our activities around the statistical value chain are tested when we move to the KT. So it was we will have to adjust as we are going along. Obviously, the issue of analysis and the issue of comparability, I think I'm not going to dwell much in this one. It's something that we also learned when we were publishing our quarter labor force surveys. So in terms of the future, we know that for now, there's a likelihood of having the second wave of COVID-19. So we are not sure whether we will be able to do the face-to-face. But if we do KT again, also, it has to be clear that we have a proper sample frame that one can use to conduct the KT. Medium to long term, I think for all our surveys, the plan is that we should be able to continue with the face-to-face. That is our plan. However, there's some risk. We will have to balance between the data collection, the data quality, and the continuing of using KP, especially now with the likelihood of us having these outbreaks. So we will have to, it become a sort of a balancing act. But then the proposal that we are putting to our ESCO members is to say, let's continue with face-to-face following the health protocols. Obviously, there's a cost in terms of following this method because you have to buy the PPE. And then we will probably do what we're calling a listing methodology where you go to a household and then you collect their information, but you don't conduct the interview so that you limit the time that you spend with the respondent. Long term, the issue of the frame is something that we are working closely with our colleagues to say, how can we improve our sampling frame? And we have to test the methodologies, like I said, especially post-census. In terms of census, initial plan for face-to-face KP, unfortunately, because of COVID, things have to change. They will be conducting a series of tests to test the CAWI and KP and KT. Like I said, the plan is to conduct a pilot early next year. So since we don't know the future, we are faced with impossible choices. I think from our side, I think in conclusion, we are saying we will do the face-to-face. Obviously, with all these other risks that we need to, we are aware of them and we have already identified them. And I think it also have shown today that we will have to live with this risk and see how we balance all these things. So we're hoping that one will be able to conduct the survey face-to-face following the health protocol procedures. But at the same time, the remote data collection using KT or CAWI, it has its own benefit. We will be able to complete the data collection much more faster. That we don't have the issues of threat to the health and the well-being of our survey officers and respondent. But however, there's those risk when it comes to your sampling, processes and also your non-response rate, which tend to be higher in using these data collection modes. So I think for us, it's a case of hoping for the best or mitigating the worst. So I think that's where we are in terms of the surveys from our side. And I think we will probably share in terms of the more detailed plan when we get to probably the end of the year, because I think that at that time we'll know exactly what is it that we're going to do for 2021. Thank you.
Thank you, Soli. Yes, so many challenges to think about. I know that you have to leave early, so I'd actually like to take your questions now, immediately after your talk, also because we're doing very well on time, so thank you. There are a couple of questions that are in the chat. Could I ask all of the other participants to just type things in, or else you're very welcome to just raise a hand and ask your question verbally if you'd like. Soli, I think some of these you've mentioned already, but please have another look and see if you can answer them.
Okay, thank you. Regarding the sample frame that we used for the 2020 program, what we did is that we went back to our data and we looked at the dwelling unit that provided us with the telephone numbers. And that's how we conducted our surveys for 2020 program. Hence, I was saying in the presentation that this is one of the challenges that we had when we were doing our surveys. With regard to the timeline for Census 2021, for now, we don't think so that we will be able to shift it because there's financial implications. But then we're hoping that we will be able to conduct it come October 2021. Yes, the February 2021 pilot is for census, Tara. So like I said, the aim is to test for Kawi and Katie because these are the two data collection modules that we didn't test. We were testing the Katie face-to-face. So in terms of the specific challenges for census, census will also experience the same challenges that we as surveys are experiencing. Because we need to cover the whole country in terms of the census. So hence, I think when we're doing our pilot, one will have a sense in terms of how are we going to do this. It's something that we are working closely with also our stakeholders, that are responsible for telephone numbers like your cell phone telecommunication providers. So that's what we are hoping that we should be able to work with them to source these numbers. I think I've already touched on the one when you say we have to explore other sources. Yes, it's true. And we have a working group that is working with all these telecom companies. Love to know your thoughts about the variable implication for different service species. So I think the last one is something that we also are trying to write up a concept document around it. Because we know that there is going to be a little bit of a challenge in terms of having to use the sort of a mixed mode. So I think for now, I will rather say that we will share what is our view in terms of this, the use of Kawi and Katie. So I think I will suggest that maybe we should share the document that we are busy preparing. I think it will give more insight in terms of where. In terms of the parallel run, because I saw there's another post, the parallel run, yes, we wanted to conduct the parallel run. Unfortunately, it comes with a cost. And as we all know that because of the budget constraint, one couldn't able to conduct the parallel run. So it's something that we were hoping that we will do, but then unfortunately, because of budget cuts, one cannot able to do it.
I think that last question was also about using administrative data out of other parts of government. Is there a process of coordinating some of that?
Yes, it's part of the work stream that looks into other sources that one can use. So it's from the private sector and also from the from the public or from the government department, and also our SOE companies.
Yes, okay, fantastic. Thank you very much. Are there any other questions for Soli before we move on to Prof. Mattes, to Robert? Okay, I think Soli might have to leave at 11 o'clock, but obviously if other questions come up later, we can still send them out and continue being in touch. Absolutely, so, and thank you, Soli, for offering to share the documents, your discussion documents. I think this group of people who are all struggling with the same things in our various organizations would be really very interested in all the ideas that are coming out of StatsSA.
Okay. Thank you.
Great. Thank you very much. Let's hand over to Robert.
Good morning. Good morning, Tara. Can you hear me?
Yes, wonderful. Thank you. Are you able to share your presentation from your side?
Okay, can everybody hear me?
Yes, loud and clear.
Okay, great. I'm just trying to fix my view here so I can see. Okay, somehow I've lost view of the gallery, but I'll just go ahead with view of my slides. Also, can everybody see the movement?
Yes, that's working fine.
Thanks, okay. Yeah, so thank you for inviting me. I will spend a few minutes, in case people aren't that familiar with Afrobarometer, just to say a few general terms about the project. And by doing so, it will then, you'll be able to see the challenges immediately that are posed by a phenomenon such as this in the way we try and do our work. If you're unfamiliar with Afrobarometer, it's a project that's been going on for about 20 years, gradually expanding in scope to measure Africans' attitudes about democracy and governance, their experiences with well-being, and their evaluations of how the economy and how the government works. And the real strengths of our project is that we produce reliable, scientifically reliable data. We have a strong capacity building element, usually with a summer school at the University of Cape Town every year, and then devote a huge amount of resources to disseminating the results through, originally old style kind of work, and now with much more younger staff teaching us how to be very effective in using the internet and Twitter to disseminate results. It's structured as a network. We've got now partners in 36 countries across the continent, mostly civil society organizations or private research firms. Some of them are basic universities. We have core partners who then take the responsibility for technical assistance in areas like sampling and field work, and also work with dissemination in each region in Southern, West, East Africa. And we also have 2 support units who work with issues around data quality and analysis at Michigan State University in the United States and at UCT. So just right there, just the vastness of the project and the network nature suggests you can already anticipate that, when one makes a decision at, say, the headquarters level or at the level of the board, it takes a while to filter that through and negotiate the terms of that with a wide range of partners. The types of things we focus on in the questionnaire, and it also, goes to thinking about issues of respondent comfort and confidence in the interviewer. So we put a lot of questionnaire space into measuring people's values about politics, the economy, and society, their evaluations of how government and politics is actually working, to what extent they have what is their level of education, how often do they use news media to talk about politics. So we get at the citizenship angle quite extensively. Also some work which has really helped define one of our real, I think most attractive products is the measuring quality of life with our index of lived poverty and access to development and basic service delivery. And then the standard demographics. So again, this is quite an extensive interview instrument. Interview length runs usually from a minimum of about 45 minutes to an hour and 15 minutes. Of course, that time shrinks over time as regardless of how much training you do with interviewers, there's still a noticeable significant reduction in interview time during the, say, 3 to 4 weeks of field work from the first week to the final week. And again, when we look at how we do our surveys, you'll immediately see the kind of implications of the pandemic. So our stock and trade, our real value added is that we have focused exclusively on in-person interviews conducted in the language of the respondent's choice. And and administered to a nationally representative sample that is based on the best census data that we can secure in each country we're working with. And also that the questionnaire, those questions you just saw are standard as much as possible. So, it's the real comparability across many countries. There is room in each country for country-specific questions, but again, our real value added is the ability to be able to say we've done the same as, measure the same values in the same countries at relatively the same time or within the same year across countries. And as we'll see in a few minutes, there might be country-specific fixes that you could adopt different types of surveys or different types of computer-assisted telephone interviewing in different countries, but then immediately it runs into problems of whether we're actually saying we're measuring things the same way across countries. This is a map of where we're working with. The only other thing that would be, I think, added to that in the current round 8, we've added Angola, but basically we've done 7, and I'll speak about round 8 in a second, but we previously completed 7 full rounds of data collection, starting with 12 countries in 1999-2001 round 1, and we 2016 to 2018 did 35 countries, and our real expansion was around 2011. With the assistance of the Mo Ibrahim Foundation, we went from 20 countries to a much broader range of countries, which was a real challenge, but I think we've risen to that and mastered that. But again, it increases the size of the organization and just raises many more challenges for making decisions and thinking about how to respond to COVID, which is itself has a huge variation across the continent in the extent of its impact. So round 8, we had secured funding and planned on doing 37 countries. They were going to be in 2019, 2020. We completed 18 by March 2020. When we brought a halt to all fieldwork, it was just about the same time as universities like where I am, Strathclyde or Cape Town, issued their own orders halting face-to-face fieldwork. And then since then, and I'll speak about that in a moment or so, have been really working a lot on the same kind of planning you've heard from the previous speakers about how do we decide when it's safe to go back in the field, and that we've done our due diligence to do everything we can do possible to resume our work, but in a safe way. So again, we did 18 countries. That data has now been cleaned and merged, and we are starting to work on that. And we plan on releasing results on 18 countries starting early in January and February on a range of key topics. So what about the rest? How did we finish? So we immediately started a series of planning steps to figure out ways around it. And of course, the first one was to think about exploring the potential for some combination of telephone or internet surveys. And just looking at our own, because we had collected data in previous rounds of surveys about people's access to mobile phones, people's access to computers, et cetera, we knew there were large gaps in access and coverage in a large part of the countries we were working with, especially in rural areas. So again, any solution to that had to take that into account and threaten the equality of our responses, the comparability of our responses across countries. And even where people report having phones, we know that a lot of people in rural areas say they just don't have them with them, the same way as, say, if you're running around Johannesburg, you've got the cell phone is attached to your hip at all 24 hours a day. Lots of rural people simply have it at home. They don't take it with them during the day. There's battery and airtime issues. And so even if you really could do a representative survey, I think either through the telephone or internet, there's also issues about the limits of the length of the interview, which then, again, it cuts into what I think our value added has been over time. So we really decided that wasn't a realistic solution for us across countries. Although that being said, we still are going to do 2 pilot telephone surveys. The first one is in Namibia. It's not 2 in Namibia. Sorry, I just wrote that a bit incorrectly. We're going to be doing 2. And the first one is going to be started in Namibia, I think, in the next few weeks, just to see what the possibilities are and how far we can push, how long we can go with an interview, how much, what is the response rate, and what is the level of representativity. We also then planned out, and again, this is not new. I've heard several speakers already have just spoken about these things, developed a series of protocols for resuming the resumption of in-person field work. And those steps started with, first of all, looking at the national status. So basically saying, there is an issue of whether you should be making cross-continental decisions when, in fact, the country said, we're doing work here in our country, our field work, our partner in a given country might be doing work, saying there's not really a problem here, don't impose the problems of South Africa or other countries on us. So the first stop really in the protocol is to check the in-country status, looking at whether our national partner is doing continuing work of different types for their own, if they're doing work for their own government or other clients in their own country, but also looking at data, looking at rates of decline and general trajectory of infection rates. But of course, there are countries on the continent in which that data is not trustworthy, either for a lack of capacity or simply not releasing data, Tanzania being a great example. So the second issue is really going to organizations like the World Health Organization, or I didn't put it here, the African Center for Disease Control, for guidance on the reliability of the national data. So not just taking the country's word for it, but that is the first step, is to look what the in-country conditions are, but then to look at reliable international data for a second check. And then checking national laws and health guidance issues at the time, looking at IRB constraints within if our partner is at a university. And also looking at the national partners' assessments of the research landscape. So all of these things, then there were pretty extensive protocols developed so that each partner would have to fill these, extensive amount of information about each of these and feed it back to us. Also, number 5, we insisted that the national partner would be able to produce their own written plan of a numerator and respondent safety plan, which would include, and we had to then come up with a budget for this, including cost of PPE for field workers, other medical equipment for temperature checks, et cetera. And again, we've already been speaking about this, in the earlier presentation. So these are common issues we seem to be responding to in a fairly common way. We've also are in the process of conducting pilot interviews in countries where we've already received the data back. So I think in Ghana, where our headquarters are, we are then going to interview a similar sample within the area around Accra, and compare, but using PPE and using social distancing, and compare those responses to a comparable demographic sample before COVID, just to get some assessments of what it might do to the results to conduct interviews under the conditions of social distancing with PPE, to see if that has any kind of effect on respondents or respondents' trust in the interviewer. And we know through a lot of our data has demonstrated that while many of our respondents, still think we are from government, even though we've told them we're not. So the interview starts with saying we're an independent research organization. It ends with a question saying, who do you really think sent us? And 40 to 50% of people in most countries will say you're from one or the other government agency. And in most places, that's not a bad thing. It's in places like Zimbabwe historically, for example, where that means respondents may be a bit more guarded. But we found out the most important variable is we also have the interviewer collect a lot of data at the end or fill out information about the interview. Was the respondent nervous? Did they seem to be guarded? Were there more than one person in the room, et cetera? And we find that it's the respondent's sense of nervousness or trust in the interviewer that makes a big difference. So even if you think you're from the government, if they trust the interviewer. So we know in lots of less democratic places with higher levels of limitations on civil and political rights in Africa, people will be actually more negative, even if you're thinking you're from the government, they'll be more negative if they trust the interviewer, and they will use the interview as a way to say things that they can't say in the public space. So we really want to make sure that for whatever unanticipated reasons, conducting interviews with social distancing and PPE is not going to affect that, or at least to find out some information on how that might affect it. And lastly, we will also want to make sure that we are still able to provide the kind of technical assistance we have in the past. So can we send a team into country to assist with sampling, to oversee sampling, to assist with pilot training and interviewer training? And if not, can we at least adequately do that remotely? Can we establish the correct, are we able to establish connections to work with large groups of people? Does the local national partner have those abilities to assemble those people for a Zoom conversation or something similar? Also, we've added for the remaining 16 or 17 surveys, when we go back in the field, that questionnaire will contain an additional special COVID-19 module in the remaining countries, asking people for their experiences. It won't be very long. We don't have a lot of room, but a small module looking at people's experiences with COVID and also their evaluations of how government responded to that. And lastly, I think from a scholarly standpoint and a policy-making standpoint, one looks back and says, the fact that we had in a sense, a thinking experiment in terms of experimental design, we have an opportunity to do really, in ways that we never would have thought, but just because of the fortune or misfortune of when the disease happened, pre and post interviews. But that would mean going back and re-interviewing those 18 countries again, which of course has enormous costs, and we simply can't afford to do that. So while the ideal would be to go back and re-interview those 18 countries, again, we can't do that. We have contractual obligations to our donors to complete all 36 countries. But there is a second best solution. I just wanted to leave as the last observation, that we may be in a position to use a logic in political science known as most similar systems logic, in the sense that because setting up experiments, especially at the country level in political science, is a really difficult proposition, we've often used a method called most similar systems logic, where we take countries that we think are as similar as possible on the variables that we think are important. In a sense, they become a kind of a control. And then we look for something which makes a difference between those countries. An experimental like a natural experiment. So we do have the possibility, simply because of the 18 countries we did, that if we broke them up into upper, middle, and lower income countries, which is always is a really important variable in terms of understanding differences across Africa, but also just by region within those things. It turns out that that if we are able to look at, say, while they're not identical in any way, there is enough of a similarity to say if we didn't see, for example, a decline in evaluations of democracy in two wealthy Southern African countries before COVID, but we see it sharply in two wealthy Southern African countries after that, it allows us to make some sort of inference, clearly not a conclusive set of inference, but we are in a position that I think will make it interesting to use this kind of design logic to say, can we draw some inferences about the impact of COVID, not just looking at that special module, but looking at things that are common in the Afrobarometer, but by comparing across income strata and within region on a pre and post basis. So that's all really I wanted to share with you this morning. I will try and get back to the full screen so I can see any comments.
Thanks so much. Tyra is unfortunately having connectivity challenges, so I'll just take over as chair for the moment. There's just a couple of questions from myself so far. I hope others will feel free to jump in with additional thoughts.
Yeah, and for right now, I cannot, somehow I have lost the full screen.
I'm just popping,
there it is.
There we go. I'm just popping the questions up on the slide as they're coming in. Are you able to see those?
Yes. So we think we will resume, I think, and again, because of the, I'm now a senior advisor, a kind of old gray-haired man in a rocking chair. I get the data without doing a lot of the work. So that's kind of a great thing. But also means I don't have the day-to-day kind of pulse of the decision-making. But from our last board meeting, I know we are thinking of restarting research in places like Mauritius, I think, within the next month or so. So, yeah, so our hope is that from the next month or so, over the next 6 months, we will complete the remaining 17 to 18 countries. And again, yeah, as I mentioned, the COVID context or the COVID methods changes, we will at least try to get some data on it by in Ghana doing a small survey using PPE and comparing it to the same provinces' results before without PPE to see if you know, on the questions that shouldn't change a lot. I mean, a lot, we wouldn't re-ask the political evaluations because those would be expected over the economic evaluations to change a lot. But on basic values, on demographics, just to basically see, do we get comparable answers? Or are there any kind of noticeable differences that we could attribute to the interview method? Julia, do we have other questions?
I'm just popping a couple more up. One around whether you've had to drop any content to accommodate COVID.
There will be, because again, the questionnaire is pretty full. So to add the COVID content, we are trimming other things, and that's done. Right, we do have the virtue of now looking at results coming back from the first 18. I really can't talk in specific. I know, for example, that some of the questions we tried to put in to measure populism didn't quite work. So we can do some basic, you know, scale analysis right now and find, you know, maybe drop some of the items that didn't seem to do help us very much in order to make room for the COVID result. And I think that that method is being used for other scales and indices.
Fantastic. And then there's one last question about IRB applications. And this is a question also for Ayesh and Tamika.
I mean, for us, the questionnaire generally has been undergone IRB at University of Cape Town to cover the entire network. And it's also then national partners then follow the same, whatever protocols are relevant for them in their own country, whether it's just seeking government approval. And that's not always as you know, oppressive as it might sound. I mean, in some of our longest standing democracies like Botswana, it's a regular thing. It's our national partner always asks for approval. It's always granted. It's more of a way of the government kind of understanding what's going on out in the field. And also they have a fear, which I think is unfounded, is they don't want other surveys coming out at the same time as their state, either the census or the state statistic office's surveys, which, you know, I don't think is an issue, but they always are wondering about that. In other places where our partners might be based at universities, they would go through their own university-based IRB process. And I think that process is undergoing right now, of seeking all those approvals. And that's also going to determine which countries we restart in before others.
Thank you. Tamika and Aisha, do you want to come in? Do you want to come in there? And sorry, I know we've been sort of taking questions after the end of each of the presentations, but if you wouldn't mind taking this one on, and then we'll come back to the rest of your questions at the end still.
Sure, no problem. So we were already in the midst of field work when it happened. It didn't have any impact on our IRB ethics applications. But I do think that going forward, if we repeat the study, that we will need to factor in certain COVID safety protocols to extend the ethics application or get a new ethics application going forward.
Actually, just on that, can I just follow up? So you didn't actually have to go back to IRBs to get a revision in order to go back into field with a new model?
No, we didn't. And in Mozambique, the IRBs, the way it works is they do accompany you on some fieldwork visits. so they could see the safety protocols that were being put in place, but we didn't have to formally submit anything.
Okay, all right, great, thank you. I'm back with my network more or less stable, so I hope I'll be able to thank you, Julia, for stepping in. Are there any other questions for Robert before we move on to Ben to talk about the HSRC project? All right, so both Ben and Julia are going to have fairly short presentations, which means then at the end, we're going to have a nice long time to engage with Tamika and Aisha, and also with just the overarching themes that are coming out of everybody's presentations. Ben, are you good to go? Yes, that looks good, we can see. Ben, not hearing you though.
Ben, we don't seem to be able to hear you at all. Ben, still nothing coming through.
Maybe Julia, while Ben is figuring out what's going on with the tech. Sorry, Ben, can we, can you go first? Okay.
Yeah,
Thanks, Ben.
sure. Let me just pop my slides up. Great, so can people see that? No, not yet. Is that working? Can you see the slides? Great,
yes,
fabulous. Thanks so much, and good morning, everyone. So I'm just really going to provide a very brief update on the Gauteng City Region's Quality of Life Survey and how COVID-19 has impacted us and what we're doing to manage it. So I'll start with a very, very brief overview of the survey for those of you who might be less familiar with it. The GCRO has started running the quality of life surveys in 2009. We completed the 5th survey in 2017-18 with 24,889 respondents. So over the years, it's grown into one of the largest social surveys in South Africa, and it's been run roughly every 2 years. It is a randomly sampled household survey covering the entire Gauteng province. We aim to measure the well-being of Gauteng's residents, and we do so in a way that defines well-being very, very broadly. So we look at things including socioeconomic circumstances, living conditions, perceptions of service delivery, psychosocial attitudes, political attitudes and beliefs, values, health and well-being, and much, much more. Obviously, this means that it is a very long questionnaire, usually an average interview time of about 45 minutes. It provides spatially fine-grained insights into the lives of residents of Gauteng, which is very valuable in a context where we have extremely high levels of inequality and a very diverse population. And it can be analyzed, obviously, at the provincial level, at the municipal level, and in some instances, even at lower spatial levels. This is just a quick overview map to give you a sense of how our samples are distributed. And you can see, sorry, in this map here, these red spots are the respondents in our Quality of Life 5 survey. And we basically sample to cover each and every ward in the province. you can see there's a much greater density of respondents in areas with greater population density, but all wards are covered. So we're planning our next iteration of the Quality of Life Survey for 2020. And I'll give you a bit of a sense of how that's been impacted by COVID, as well as what we've done about it. So in 2019, we spent much of the year conducting an extensive 10-year review of the whole Quality of Life Survey, which gave us some really great insights and recommendations on how to approach future iterations of survey. We were planning to be in the field with Quality of Life 6 in March or April 2020, with completion by the end of 2020. And everything was very much on track and moving smoothly until we realized, I think early in February, that COVID-19 was likely to have a substantial impact on our work. By early March 2020, it was clear that we were going to be looking at significant delays, but I think somehow in the back of our minds, we still thought that COVID would be passing through and then would be over and we'd be picking up data collection in a post-COVID world. In retrospect, that obviously wasn't at all realistic. We went into something of a holding pattern and focused on preparatory activities and a lot of contingency planning. We considered alternative methodologies, but for our purposes, they were not viable for various reasons, such as the fact that the survey is used extensively for tracking changes over time. We were concerned about longitudinal consistency, the fact that we really rely on having a spatially distributed sample, which is hard to achieve through remote methods, and then importantly, our instrument length. For a while, we were working under the assumption we wouldn't be in field until 2021, but it subsequently became clear that the peak was approaching and we would be back in field sooner than expected. We also became increasingly aware that COVID was going to be around for the foreseeable future. And given the importance of the data we collect to government and to planning purposes, that it would be necessary to go back into field, accept some level of risk, but also put appropriate precautions into place. We did manage to reallocate some funding internally to cover costs of PPE and other additional costs. In terms of our prerequisites for going back into field, we did require that we were seeing an ongoing reduction in cases, clarity that work was legally permissible, and this we did submit an updated application to our ethics committee for approval to return to in-field data collection. So the first, I'm going to take you through our experiences with training and piloting. We are currently wrapping up the last of our training. Saturday will be our last formal training day. So we made several adjustments to our approaches to training for various reasons, including, again, the complexity of our sampling and the length of our instrument. We did feel that it was essential to stick to in-person training. However, we went into an approach of phased training of 2 smaller groups rather than a single large-scale training session. We have provided a dedicated COVID training module as part of the training, and of course, enhanced PPE, including masks, visors, and sanitizers, social distancing, lots of hand washing, and space and ventilation in the training venue. Our final preparations for training took a bit longer than expected, particularly with additional levels of approvals and reapprovals, and then additional logistical preparations. Finding training venues that met our requirements was quite challenging, and pinning down very concretely realistic PPE needs and then procuring them was also took a bit of time. That said, the field workers have been very, very eager to get back to work. There is some heightened anxiety, both in terms of risks related to COVID, but much more so about the difficulty of asking some of our more personal questions during such a difficult time. For example, there's enhanced anxieties around inquiring about debt, socioeconomic circumstances, hunger, and health. There have been some challenges early on in the training around compliance with COVID protocols. I think there is a level of fatigue. People are very tired of masks. But as training has progressed, we've seen huge improvements. Getting people to participate during the training has been, I think, much harder with masks and social distancing. As a facilitator, it's a lot harder to read faces. And when people are spread out, it's much harder to hear people and for people to spontaneously input into training. But we've been using microphones and adapting, and I think overall it's worked fairly well. An unexpected challenge was that our first training was interrupted by a cold front, which had everyone racing to close doors. And then that our second training was interrupted by a heat wave, which also had everyone rushing to close doors. So there are just practical challenges that one doesn't expect. Another unexpected surprise was that we had our second training in a wedding venue. When we first walked in, we thought we were game crashing the preparations for someone's wedding. You can see here how beautifully laid out the room is, and masks and social distancing and sanitization in place. In terms of the piloting, this took place during the weeks of October 5 and October 12. Obviously, we've done our piloting with COVID protocols in place. Field teams are operating independently with minimal interactions. Dedicated transport is in place, twice daily screening before entering the transport vehicle and then again at the end of the day. PPE is provided, masks, visors, sanitizer. We're encouraging wherever possible outdoor interviews and emphasizing the importance of ensuring ventilation if indoor interviews are necessary. Obviously, social distancing and minimizing any contact with participants is being strongly encouraged and enforced. We've also made it very, very clear to all field team members that field worker safety is absolutely paramount, and that if at any point anyone feels vulnerable, feels that they may be exposed, that they really need to remove themselves from that situation or call for support if necessary. We do have available always masks for any participants who may not be wearing masks or may need a clean mask. And we are instructing field workers that they cannot be interviewing respondents who aren't themselves wearing masks. Overall, in terms of the feedback from the pilot, in a way, a surprise for me was that there really weren't any unusual challenges encountered. Most of the feedback we received related to very typical technical teething troubles, safety and security, access negotiations, and a few questionnaire refinements. I've got a couple of pictures of our teams out in the field doing some publicity work to try and improve response rates during our pilot. You can see this group with their visors on, this group without visors, engaging with passing motorists. It's been hard so far with the data available to gauge whether COVID has really impacted response rates. We've had a couple of refusals due to COVID, particularly among elderly respondents, which is completely understandable. And obviously we're not at all able to do any interviews in retirement villages and old age homes. We have seen some shifts in populations in some areas. For example, areas which are usually full of students are much emptier. We've also heard that some informal settlements are much emptier than usual. On the other hand, in more affluent areas, a lot of people are still working from home, which actually makes them a bit more accessible and available for an interview conducted at their home. So we're not quite sure how it's going to play out in the long run yet. And we will obviously need to look at shifts in population in terms of sample representativity and how we go about weighting our final data. There haven't been any major concerns raised about our COVID protocols from field teams or participants. Visors prove quite challenging, particularly when working with a tablet outdoors. There's a lot of glare and reflection, which makes it very hard to see what's going on. Participant preferences around COVID protocols vary substantially, and field workers are trying to be responsive to preferences while protecting everyone's safety. We do make sanitizer available for participants should they wish to use it, but not everyone is, and I don't think it's really strictly necessary given that we're not doing in any direct contact. We did have some laminated materials available, but it's been clear that that doesn't work even if they're wiped down with sanitizer. People just don't want to touch them. So that's sort of the short-term feedback. In terms of our longer-term planning, we are currently finalizing field worker training and anticipating full-scale data collection to be underway next week. If we are able to operate at full scale, we expect that our data collection will be completed in April 2021, but obviously there's a great deal that is very much up in the air and quite a few things that we can't really plan for completely. For example, the biggest question is obviously when will a second wave hit and what will the implications of that be? How do we make a call about if and when it is no longer safe to work? At exactly what point do we make that decision, and how do we weigh the risks related to COVID against other risks that field workers are also exposed to? And then obviously what will happen if a field worker does become infected with COVID? How effective will our protocols prove to be? We're obviously doing our best to manage risk. We're working across the province so that if we are interrupted early, we will be able to have a somewhat usable data set at a smaller sample size and perhaps have a sort of pre-second wave, post-second wave data set to look at. We're continuing to monitor infection data very closely, both at provincial and local levels. And we are constantly monitoring emerging knowledge about COVID transmission and management of prevention, modes of prevention for COVID transmission to ensure that our protocols remain completely up to date and as effective as possible. So yeah, I'll wrap up there. Just particular thanks to the GCRO colleagues, Dembiso Mkhize, Christian Hammond, and Melinda Swift, who've been working very closely with me on this, as well as to the Geospace team. Thank you very much. Have we lost Tara again? We really are struggling with connectivity today. Ben, are you able to present at this point? I think we may also have lost Ben as well. Hopefully they will be back with us very soon. I wonder if in the meantime we should maybe just hop back to some of the questions for Ayesha and Tamika, and perhaps also then I can respond to some of the questions that have come through. Would that work for colleagues? I'm just going to pop the questions.
Yeah, sorry, Ben is going to try and phone you, so because his audio isn't working, but hopefully he can speak through your phone to the group.
Sure. Do we want to, is he calling right now, or should we have a bit of Q&A? Oh, here he is. Hi, Ben.
Hi, I just want to check if this is going to work. Otherwise, I might have to abandon it.
Yep, seems to be working.
Okay, so shall I just try and present? Shall I share from my side?
I can pop the slides up, or you can share from your side.
So let me just sharing because I'm not talking through it. So
great.
Yeah, it should work.
Great, I can see them.
Okay, is it showing?
Yes.
Thanks, everyone. Sorry about this less than an adequate audio approach, but let's see if it works. In July, we presented a bit about SATAS. Sorry, I'm projecting the wrong version. Just bear with me a sec. In July, we had a presentation about SATAS, but not all of you will necessarily have attended that one. So the South African Social Attitude Survey is an annually conducted nationally representative sample undertaken by the Human Sciences Research Council. We run anywhere between 2 and 3 different questionnaire versions, sampling between usually between 7 and 10,000, with about 3,500 questionnaire versions. It's modeled fundamentally on some of the long-standing general social surveys, such as the British Social Attitude Survey, the American General Social Survey, and the German Albus Survey. It also builds on a longer history of public research at the HSRC, which goes back to the 1980s. We were in field with our annual round when COVID-19, the first case was registered on the 5th of March. And we did proceed under new safety protocols that we've developed. This included PPEs. It included also daily briefings to look at national and provincial statistics and to make informed decisions about whether to proceed or suspend fieldwork. In the end, we managed to get towards about the 3rd week of March, around the time when the president announced the national lockdown. And at that stage, we'd completed about 40% of our interviewing. Although we found during those few weeks during March that actually we're getting pretty good response rates, what became an increasing challenge was issues about access. Particularly the police became really concerned about our survey team presence, but also ward councillors showed increasing resistance to our teams being in their areas. We're not sure yet whether that will again be a key issue as when we do go back, but we suspect it might be. So we'll have to just play that by ear when we do resume. The HSRC put out the Ethics Committee put out a research advisory about face-to-face interviewing. And until level 1, there was generally a sort of suspension of all field-based activities. Level 2, there was a recognition that clinical trials could resume, but other general surveys is level 1. So in September, we made a resubmission to our Research Ethics Committee, where we had to actually submit a new research plan and particularly a safety protocol document, building on existing operating protocols which have been developed internally. We heard earlier this month that we have received approval subject to the adherence to the strict safety protocol measures. And we're currently gearing towards the 2nd of November resumption of field logistics. So we've been very busy with various operational plans, including retraining, procuring PPE, and so on. Obviously, a range of challenges, and I think there's a fair amount of commonality through all the presentations today. One of them is actually the PPE itself. We've obviously seen, and also broader issues related to COVID-19. We have seen a number of interviewer dropouts. So that's been a particular concern, have some of the experienced interviewers dropped out either because of comorbidity or because of potential concern from either themselves or from other family members. So we have seen it's not been as extensive with it hasn't been as thought it might be. There is a real concern about, obviously, risk to both interviews and participants, so the safety protocols have to be along the lines of what Julia indicated from GCRO, the kind of real range of measures from the basics, such as masks and sanitizing, through to our research efforts, which is on the infrared thermometers as well. So through to a range of sanitizing vehicles and so on. So we've had to put in a whole series of logistics. Fortunately, quite a lot of those were already in operation in those few weeks prior to the national lockdown. So it's more about a review and revise to what is already in place. Retraining, obviously there has been a 7-month interval between when we suspended fieldwork. So that means that retraining has been, and a lot of role playing on the questionnaire again has been essential. It's been really quite difficult in terms of obviously we have fieldwork spread across the entire country. So we've had to adopt primarily an approach to first doing different levels of retraining. So first briefings with provincial coordinators and supervisors, then and their sub-supervisors, and then actually specific focused retraining, mostly virtually with particular provincial teams. We focused obviously in that training on the survey content, the typical protocols that we adhere to, but also the new PPE protocols, really reinforcing those. But in common with what Dr. Say talked about, and indeed Julia, the level of uncertainty is something we're really worried about. We've already had a really long break in our survey round, and we're hearing a lot of noise now about the increasing likelihood of a second wave of the pandemic. So we're really focusing on trying to get in and get out as quickly as possible. So we're currently planning on a 3 to 4 week period, so hoping to be finished by the end of November. As of yet, we don't know what bearing this will have on substandard field activities beyond this particular round and its completion. We were supposed to actually be doing our 2020 round nowish, and so we're potentially focusing on a sort of April-May for our next deferred round, but we'll just have to see what happens in coming months. Some of the other challenges, I think Bob in his presentation talked for those, as well as the WISH presentation, but some of the budgetary contingencies. We've had to pay quite a significant parking fee for our CAPI service provider. The retraining, obviously these are all unscheduled expenditures. The retraining has obviously, but most importantly, the PPE procurement. I mean, those infrared thermometers are not cheap, and buying for multiple teams across the country is really coming at a huge expense to us. In terms of our external funders, they are always quite risk averse. They're really concerned about the nature of our protocols. So they've also wanted to see what we've put in place. They're worried about if either an interviewer or some of our respondents test positive, that might have some kind of down the line reputational consequence for them. We've also had to renegotiate all our contract periods with these funders. Some have been more generous than others, but generally we're looking at most of those contracts being deferred to around the April to August period next year to allow time for the in-depth analysis after the field round's done. We've had to make some interim presentations, although we're reluctant to do so, but just as a sense of indicative tendencies prior to what was coming up. So that's something we've had to focus on last month. So that's a broad overview. I just wanted to flag something completely different. It was actually about the potential of going back and using our data to convey health promotion messaging. And from the non-probability online surveying we've been doing in the interim, we're actually seeing increasing signs of change in risk perception amongst the public. Pandemic fatigue, according to WHO, perceptions. Earlier this week, Professor Abdul Karim talked about the fact that the second wave is now almost inevitable, with key factors determining that being complacency in other gatherings and also an easing up of various travel restrictions. If you look at the graphs on the right-hand side of the screen, you'll see the top graph. This is going to feature a Daily Maverick article that we're going to populate today. It shows that the first three stacked bars were our first period of surveying between mid-April and mid-May, and around 50%, just over 50% in each of those phases show that the worst, felt that the worst was still yet to come. This increased by the time we went back to field in early to mid-July, which coincided with the big surge in the country. But since then, we've actually seen rapid kind of taper throughout the latter half of July. Indeed, there's rapid tapering off in a sense that the worst is yet to come. So a sense of a belief that we're really, past the surge, which was obviously the initial surge, which is the message the president himself conveyed, but generally feeling that we've survived over it. And I think looking at the bottom graph, more worrying, where you see the percentage that feel that coronavirus threat has been exaggerated. We have seen, particularly in the July to September period, relative to the earlier period, a sort of increase in the share that does believe there has been an exaggeration. So I think this sort of sensitivity, this change in the risk calculus, the perceived risk calculus, has shifted to some degree, and that might partly explain the lower tendency towards regulatory compliance. And on the basis of that, we want to make some small contribution towards the need for health promotion during this time, particularly ahead of the potential second wave. So we engaged the cartoonist Gavin Thompson, who's well known for the Monarch Taxi series between the mid-2000s and late 2010s. And he designed a very basic COVID-19 cartoon for us, focusing on just simple things, the adherence to mask wearing, in public, social distancing, sanitizing. We'll be distributing hard copies, but more importantly, probably electronically, these the cartoons to households and the communities that we'll be visiting during the course of November. And we've also made sure that these have been translated into various languages. So it's very simple, quite brash, bold, just to give some, and not particularly text heavy, but just to give some very basic reminder about simple health preventative measures that can be adopted. So I'm just going to stop there and just allow the discussion to flow.
Thank you, Ben. That's very, very useful. And I think particularly what you started talking about at the end there about sort of negotiating risk timelines and things and the budget implications, all of that. I think everybody's mentioned similar points. So I'm hoping we can spend the next 10 to 20 minutes discussing those. Let's start particularly with the questions that were posed to Aisha and Tamika, because we haven't heard back from them yet. And then I think there's these couple of thematics questions that are really are for everyone, all the speakers. Julia, could you put up?
Working on it. Sorry, 1 second. Can everyone see that now?
Yeah, we can see.
The first two questions are really ones that I think apply for everyone. So let's hear from Aisha and Tamika on all of them, and then ask everyone else to talk to those as well.
Sure. So I'm going to go for two of the questions, and then Tamika will handle two of them. So I'll first speak to one on the lessons on managing relationships with the various stakeholders. And so what we felt really worked well was really having a thorough understanding of what the situation was in each of the countries. And we did that by working very closely. Well, in this case, it was member associations that were delivering the services, as well as our in-field country partner who was conducting the survey. So really understanding what it was and then documenting that communication. And so what we also did was have daily updates on what the fieldwork was like and highlighting any challenges and how that could be addressed. And obviously it is difficult to manage relationships when you have so many stakeholders, but you really do have to manage communication at all levels. So what we did was we always started by outlining what the specific challenges were, but then presenting solutions, and often went to multiple solutions with different scenarios, specifically at the level of the funder and the lead, which was IPPF. And then giving them different scenarios of how it could play out, and so that they could choose one that was most appropriate in terms of their deliverables and timelines. And then in terms of things like risk, as in cash flow and timelines, because there was a lot of uncertainty, we did have to do some negotiating in terms of our own payment milestones, and just rethink that. But yeah, that's what I can say about that. And then perhaps I can go to Julia's last question, and Tamika can field the other two questions. So we definitely do think that we're going to need to do self-screening and masks in the long run. So COVID will be with us at some level for quite a while. And it also has shown us how vulnerable we are to these sorts of epidemics. So we do plan on implementing these and having more structured COVID protocols going forward. Tamika, do you want to speak to the risk mitigation strategy and those contingency plans across countries?
Sure. So I'll just speak to the third question first. So how the risk contingency plan works across different partners in the study, since risks differ for organizations fulfilling different functions in the overall study. And I think from our perspective, we think as the partner that's responsible for the overall success of the CEIs, we think that it would be important for us to develop our own risk mitigation strategy from the onset, and have an overall strategy which can then be fed down to the country-specific fieldwork teams who would be responsible for conducting the study. And then they could then adapt the country strategy, the overall strategy further, and then communicate that back up to us so that we have a closed loop in terms of what affects fieldwork on the ground and what affects us. And then that should feed into a broader conversation, which should happen very early on, perhaps even during the inception phase, to have a meeting with the funders and the organization who is contracting us, to have an open conversation about what the risk strategy or what the risk mitigation strategy means for them, and ask them for their input on that, just so that all partners are aware of the risk mitigation strategy and the different measures that would be taken if an unexpected event were to occur. And then consequently what the effect would be on the timeline or the budget or anything else. And then this would help us frame exactly what would need to happen if in the event of an unexpected situation. So in terms of what we think that should be included in a risk mitigation plan, we think that it's important for to first do a risk assessment, so a thorough risk assessment, and then to plot the sort of scenarios on some sort of matrix which would then help you prioritize the different scenarios which could occur. And then once those scenarios have been plotted and prioritized, to develop a response plan for each of the scenarios, and then triggers. So what exactly needs to occur for a contingency plan to be put into action. So outlining what those triggers are, and then it should also include who should be informed and at what stage, and then the key responsibilities, and then potentially also a timeline. So yeah, that's what we think should be included in the risk mitigation strategy. I hope I've answered both of those questions, but I'm happy for any other comments on that. thanks, I'll hand back over.
I mean, I think there's a range of questions around the relationships between different project partners. This is something I'm personally very interested in, and I've done work with the GCRO around, as well as then the risk mitigations, particularly how do you manage relationships around differences in risk patterns and trade-offs in risks, right? So I've just put this as a question to all the speakers. What about trade-offs and risk mitigation plans? So you have an ideal risk mitigation, but it costs, it adds a cost. And if there's a limit in the amount of additional resources available, what do? Do you implement the risk mitigation at the maximal view, but reduce your sample? So, you know, it'd be very interesting to hear from all of the groups if you've had situations of those trade-offs, or if you see those coming up, right? Because in a sense, this whole series is about what are we learning that we're likely to take forward? Are we learning that the costs of face-to-face surveys are simply going to be different going forward because we have to build in these different risk functions now? Or is it that we're very risk sensitive at the moment because it's still very new and unknown, but in fact, in future, donors are not going to be willing to do a top-up for PPE or anything else. So we're going to have to find ways of building that in without having the sort of emergency, okay, yes, we'll find some new money kind of approach. So I don't know, Aisha and Tamika, do you have any additional thoughts on trade-offs before I then ask the other speakers to also speak to that? Okay, Aisha has to go. Tamika, are you able to say something more to that?
So I know from our perspective, this is something that we really struggled with. I mean, essentially, there are only 3 levers upon which you can pull to get a project done. And that's really quality, time, or cost. And we found that it was very difficult because we didn't have the upfront conversations about our risk mitigation strategy at the beginning. So we found quite a lot of opposition to us having any trade-offs in our study, and that meant that we absorbed a lot of the trade-offs. So yeah, that was the difficulty from our end, and I would be very interested to hear how other people have managed those relationships and how we can learn from that going forward.
Thanks, Tamika. Robert, are you still there? Is there something you could say about trade-offs within your large network?
Yeah, certainly that has the financial impact of just requiring that every national budget has to include PPE, additional training, and the additional pilot surveys for the phone interviews, or just, you know, the pilot that we're doing on the potential effect of the new interview method, all had additional costs. I know I think all of our donors were really splendid in saying, you know, they gave us no cost extensions to get the work done, and were very understanding. And some even said, please, you know, total up your costs and any new costs and come back to us and we can talk. I can't speak to what's happened since then. At the same time, you know, there was a lot of our costs that turned into savings because we are now moving into virtual presentation and dissemination. So that eliminates lots of travel costs. The technical assistance being done virtually eliminates lots of travel and accommodation costs. So there are, you know, depending on what you were planning on doing in the first place, there are sometimes some savings which may which may trade off the new cost. I can't really speak with any, you know, more specificity than that though right now.
Thank you. Ben, anything from your side on that?
Was that at me, Tara?
I'm still on the phone with you, or not?
Yeah, Ben is still here. Ben, do you want to come in?
Yeah, similar to some of the others have said, we found that funders have been quite willing to give no-cost extensions to the projects, but haven't been particularly willing to support the costs associated with the PPE procurement. So we've just kind of for now had to absorb some of that shock. We've also engaged in some element of cross-subsidization and shared use of certain forms of PPE across different components of the HSLC. So, for instance, the thermometers, we're working quite closely with our health teams. We've done some surveying and completed already. So we're able to draw on some of those resources that already exist within other parts of our organisation. But it doesn't overcome the fact that we have to procure still quite a large number of masks and buy the sanitizer, etc. So we are just having to try and, as best we can, absorb costs without trying to affect the general quality of the study. Certainly, looking ahead, and I think that's what Tara asked, is we're going to have to build it into as a contingency into certainly future iterations of our survey round, at least in the short to medium term. So, yeah.
Thanks, Ben. Solly, any thoughts on your side? I mean, you spoke a lot about other kinds of trade-offs that StatsSA is already busy trying to figure out how to manage.
I think Solly's had to leave, unfortunately.
Oh, yes, of course. Sorry. Yes, Julia, thoughts on your side on that?
Yeah, I mean, just very much in line with what everyone else has said. I think what's been really important is to try and map out different forms of risk very clearly, so that different partners can sort of see all the elements and come to a consensus around what level and types of risks we're collectively willing to accommodate and able to accommodate. The challenges around resourcing, I mean, much as Bob indicated, there have been some savings in terms of other work that the GCRO had planned to do but couldn't, and particularly related to travel and so on. So we were able to find some additional resourcing for PPE internally. We haven't been able to source any additional funds from partners and donors, unfortunately. And in the short term, it's been workable, though challenging. But there are definitely questions that will need resolution in the longer run.
All right, thanks, Julia. We have 5 minutes left. I'd be interested in just a very quick comment from each of the remaining.
Sorry, Tara, I think
we're still here. Yes, these things that are just on the screen here with enumerators. Oh, about employment relations with enumerators and risk to them specifically. So has anybody revised how they deal with health insurance for enumerators? And has anybody, what kinds of services or kind of costs covered if an enumerator or field worker gets sick with COVID in the field? And secondly, what were people doing in terms of paying contracted field workers who then had to stop for several months and probably had no other sources of income during that time? Just be really interested if anybody had creative ways of dealing with that or how that was approached. I don't know, Julia, maybe to start with, and then
sure.
Bob.
I mean, I think we were in a slightly different position in a few senses. Firstly, we have contracted Geospace as a service provider, so we don't employ any field staff directly, and we hadn't yet started employing. The project hadn't yet started employing anyone when this hit. My understanding is that the field workers were unfortunately left largely with very little work to do. And during training, certainly some frustrations came through in terms of efforts to source support through government social grants and so on, which hadn't been successful. So yeah, it's a real challenge, and I wish I had a more positive response in terms of health protection for enumerators. Unfortunately, I don't think we've been able to provide a level of insurance. However, we have, for various reasons, prior to COVID, insisted that field workers are employed on a base salary basis rather than on the basis of completed interviews, which does mean that they're also entitled to sick leave, and they are also eligible for workmen's compensation. So we have some protection in that format, though again, it would be great if there was financial scope for more support for them. I mean, I'd really love to hear from others who may have better solutions in place there.
Yeah, Tara, maybe I can jump in. So in terms of the setup that we have, field teams in the late 90s, the HSRC moved to a model where it invested not in internal capacity, but more in investing in small BE companies with a strong provincial footprint. So that's the model that's sort of endured over the last 2 decades. The way in which we've contracted up these interviews has changed a bit over time as well. So there's been some years where we individually contracted specific, the interviewers belonging to these BEs, and in those cases we did, for instance, have health insurance provided through the HSRC for those enumerators. With supply chain management coming through, we've moved much more to a model where we hire the individual companies and rather than the individual interviewers. And on that basis, we ask that the provincial, when they bid for the work, that they build in health insurance as part of the budgeting. So it is catered for in that way. In terms of the financial vulnerability of field workers during the last 6-7 months, that's been really tricky. We had quite extensive engagements with the provincial supervisors, and in some cases, in many cases actually, across a range of provinces, there were requests for like advance payments. Where we had, within the rules of the system, where we had actually paid an initial tranche payment for fieldwork to the provincial teams, some of those funds were provided to interviewers for advance by extension by the provincial supervisors. Beyond that, it's very much similar to what Julia's been saying. It's more indirect support or just asking them to rely on workmen's compensation. I think there's one other question that I can answer, I think, on that list, which was about how the team's feeling now. So there is, like Julia said, with the GCRO quality of life interviewers, a real appetite to get back to field. I think partly that is a reflection of the financial vulnerability that they and their extended families face. But I think also it's about, just this mental stress of not actually being able to work for such a protracted period of time and wanting to go out again. So I think generally that would be, there are obviously circumspect, there's a real caution about it. I mean, I think they're fine with PPEs because we were doing it prior to the lockdown, but I think there's some element of concern about, are they going to be exposed to undue risk from respondents, or go and knock on a door and do interviewing in a household that might have either had previously or currently has someone that is infected. So there is an element of, based on the debriefing sessions we've had in the last week or two, there is some concern about that. We are, like Julia has indicated with the GCRO case, going to be providing sanitize, where respondents is okay with it, sanitize respondents as well, and do indeed outdoors interviewing where practical. But beyond, those are the kind of issues that seem to be coming up. That, as well as urgent criminal activity. So the Western Cape teams are a bit worried about gangsterism, the fact that they're worried that it'll be quite difficult for them to do surveying in certain areas with the handheld devices. So they're making a particular request, can we work on paper and then enter it onto the handheld devices at the end of the day. So we're dealing with some of those kind of issues at the moment.
Thanks very much. So we've passed the end of our time. I know that quite a number of participants have left, but there's still a series here. Robert, is there anything else that's, and Tamika, you are able to add to this before we close? Robert first. You're on silent. Thank you.
Sorry, not really, Julia, but again, thanks for the invitation. It's been really interesting to compare experiences.
Thanks so much. Tamika, anything to add on what we're just talking about now?
Nothing from my side, but also thanks so much.
All right, well, thank you, everyone. I think that was absolutely fascinating, and we're all very much still working out what these risk protocols look like and what the longer term implications are. As always, the recording of this session and the presentations will be up on the GCRO website in the next couple of days. And I think you will get an email with that link and a reminder. Thank you very, very much to Julia, especially for the incredible coordination work for this entire series, to Ben as well as a co-organizer. I think the three organizations have really, really enjoyed working together. GCRO, Social Surveys Africa, HSRC. I think we need to talk about continuing something similar, but for now, this particular series is over. And thanks to all of the participants, all of the speakers, and all of the behind the scenes people, Thembiso as well. Thanks. Julia, anything else to add? Ben?
Just a big thank you to everyone, and I'll look forward to picking up conversations about what next.
All right. And I think from my end, Tara, I think it's just been a very important series to have. I don't think we do enough methodological reflection on the lived practices of surveying, and so it's been really good to, over the past few months, really engage in that in certainly very exceptional circumstances.
So thanks, everybody. Have a wonderful rest of your week, and we will be in touch. Bye.
Wonderful. Thank you.
Bye.
Bye.